Hi, Dr. Huffman. I'm Erica Wren, and I'm ready for my head-to-toe checkup. Here's my blank rubric. Nothing's on it. Here we go. Hello, how are you today?
Fine, thank you.
My name is Erica Wren. I'm going to be your student nurse from Saginaw Valley State University. Can you tell me your name and date of birth, please?
Kelly Wren, 3179.
Perfect. And where are you today?
I am Smith Creek, Michigan for a checkup.
Perfect. And what year is it?
2025.
Awesome, Kelly. Can you go ahead and get started by telling me some allergies that you have?
I don't have any kind of food allergy or anything. Just in the fall, ragweed starts like mid-August until the frost. I still take an allergy medicine until the beginning of December, just because I go up north and it's musty up there. So
Okay.
I'm still on it then.
Yeah, no, not a problem. So today we're going to be doing a head-to-toe physical. So that is exactly like it sounds. We're going to go from the top of your head all the way to your toes. I'm going to get started with some like health history questions. So you said you take medicine for those allergies.
Yep.
Do you take any other medicines?
A women's multivitamin.
Okay.
Just because,
Okay.
I guess, because I'm older and they say different vitamin D and whatever. And like I said, Zyzol's the allergy medicine. And I take a carbamazepine,
Okay.
which I've taken since 1998
Okay.
for seizures, and I just still, I've had surgery since then, but I choose to still stay on it.
Okay, so you had seizures, you don't have them anymore?
No.
Okay, sounds good. Can you go ahead and tell me like any other surgeries that you've had? You said you had like surgery for your seizures.
Yep, July 5th, 2005 was the brain surgery. Before that, there wasn't anything. Otherwise, I had my daughter in 2005, and in 2006, I had my tubes tied.
Okay. And then no other big hospitalizations other than those?
No.
All right, no problem. What does your other like health look like? Like, would you wear hearing aids or anything?
No.
What about glasses or
yeah,
contacts?
I have glasses. Well, I'm wearing contacts now.
Okay.
And that's what I usually wear. Sometimes glasses go in like in the evening or
Okay.
during allergy season.
All right. What about your family history? Anything like that?
Family history, bad hearts on both sides.
Okay. What is that like? Does that look like your parents on both sides, or like grandparents, great grandparents? How far back?
My dad's side, he had a heart attack at 55.
Okay.
My grandpa at 60. My grandma passed from a heart attack at 73. Like, they have
all the way down.
Yeah. My mom's side, on the other hand, it's just my grandpa and uncle. So luckily my mom didn't have that, but
Okay. Good. And do you do anything for that? Like, do you go to heart doctors, or do you just kind of stay with the physical? Have you had any troubles?
I haven't had any troubles. Just do the physical and try to be healthy.
Okay. With being healthy, do you like? What does your diet look like?
I still work every day, so it's actually easier for me to pack healthy lunches, like throw a salad together, or
Okay.
yogurt and crushed almonds is really easy. So I guess it's lazy man's lunch, but it's also healthy. So fruit and vegetables and like yogurt with almonds is my basic lunch.
Good. So you hit the fruits, veggies, proteins,
Yeah.
things like that as well. All right. And what about exercise? What does that look like for you?
My job is exercise. Most people would say I'm very active at my job, and then when I get home from work, I like to do things that seem like exercise to me than my regular routine.
Okay. So that regular routine of work, like, what does that kind of consist of? Like?
I'm a utility worker at a landfill, so really all year round I'm going up and down hills and walking a whole lot of steps. So.
Okay. And then at home, what do you consider working out?
I was like trying different things, like rowing machines, elliptical, but then I like trying different, I don't know, just workouts of different kinds.
Okay, like weights?
Boxing,
or like more body
personal
weight?
Yeah, you use more of body weight to do the different things. So.
And then what about like your bladder or your bowels? Like, how are those? Do you have any incontinence?
No.
Anything leaking when you sneeze, cough, anything like that?
No.
All right, perfect. What about smoking or drinking?
Nope. My dad was a smoker, and I just never.
That includes like vaping or
No, nothing.
Okay. What about drinking?
No.
No drinking. All right, perfect. So you just seem to be overall in healthy shape.
Yeah, I think so.
All right, perfect. No pains or anything today?
No.
All right.
I started to say no. I just have a hamstring I pulled 4 weeks ago when I was running, so I
Oh,
do
no.
have a sore left hamstring, but
Okay.
it's fine.
Is that kind of all that's like pain right
yeah.
now? All right. When does that usually like tend to hurt you?
Oh, just when, like I said, I'm on my feet all day, so yeah, when I'm climbing the hills, it's like, oh, I wish this hamstring would get better.
Okay.
It's not a big deal. It's just whatever.
Just
It's not 100%.
all right. No problem. Then with that, I think we're good to go ahead and get started with your vitals if that's fine with you.
Yep.
All right. Perfect. I'm gonna go ahead and grab my blood pressure cuff. Do you have a preferred arm?
I usually just do the left, so.
All right, no problem. And how are your vitals usually when you go to the doctor? Is anything abnormal? Any high blood pressure, low blood pressure,
No.
high heart rate, low heart rate, things like that I should know about?
My blood pressure is usually fine. My mom has high blood pressure and brother, but me and my dad always seem to have like a fine. It's always maybe even sometimes a little lower than some people would think. What else did you ask? What other? Oh, heart rate. Heart rate.
You can go ahead and relax.
It's normal for me to be like 55 to 65.
Okay.
That's normal for me.
So a little bit on the lower side, but you're active as well.
Yeah, so it's not anything anyone's ever acted like was a problem.
No problem. All right, I'm just going to go ahead and put the diaphragm, my stethoscope under here. I got 114/68. Does that sound like a kind of a normal for you?
Yep.
Perfect. That's within our normal range as well. Obviously it's a little bit on the lower side, but not concerningly low or anything. Thank you. Cool. Alright, I'll go ahead and set this down, and then I'll go and grab my thermometer. So this is a tympanic thermometer, so I'm just going to go ahead and turn it on, have new caps on it. I'm just going to go ahead and move your hair, reset. Any discomfort with that?
No.
Perfect, so you are at 99 degrees. That's still healthy. Have you been feeling warm or anything lately?
No.
That's on the lower end of like high, so we'll just kind of, I would recommend you keeping an eye on your temperature,
Okay.
making sure you're feeling all right, but no concerns there. I'm now going to go ahead and just check your pulses. And so I'm going to start with this, and I'm just going to count it for 2 minutes. All right, you had 67 for your pulse, and then you had 9 for your respirations. So it's like a little bit on the lower end, but you're healthy and active, and I don't see you using any accessory muscles or anything as you're breathing. You look comfortable.
Yeah.
I'm now just going to go ahead and look at your hands. I'm looking for any clubbing. I do not see any clubbing on your fingers. This would just show poor oxygenation. And so a combination of no clubbing, no accessory muscles, and then your respirations. I'm confident that your SpO2 would be high 90s to 100. I do not have an SpO2 monitor to check that though, so I'm confident to go ahead and continue.
Mm-hmm.
So from this point, I'm just going to go ahead and kind of move my way to your head and then kind of back down. So I'm just going to look at both hands again. I'm just looking at your hands, and then we look at your arms.
Oh, sorry.
You're okay. So I see freckles and some moles. Are those normal?
Yeah, I've always had them. This freckly one here is like a birthmark. It wraps around my neck. I've had it
Okay.
since I was born. So.
No changing your borders, colors, anything like that with
No.
any of those? All right, I'm just going to go ahead and feel muscle tone. They feel even and symmetric. All right, and now I'm going to go ahead and assess capillary refill. So this is just me squeezing the nail beds. Your capillary refill is quick, under 3 seconds. It's within a second actually, so that's good. That shows good blood perfusion back to your even smallest extremities of your fingers. I'm going to go ahead and check for symmetry with your pulses. Strong and symmetric. Good, so your radial and brachial pulses are strong and symmetric. I'm now just going to kind of test for overall strength of your arms. So if you could kind of karate chop forward, and then I'm going to push my hands outwards. I want you to resist. Good. I'm now going to squeeze my hands forward, and I want you to resist. Perfect. And then flip your hands. Same thing. I'm going to push up, you push down. Yep. Flip them. And then I'm going to push down, you push up. Perfect. And then can you squeeze my fingers? Perfect. So I feel strength within your arms. Now, do you know like swimming motions?
Yep.
Perfect. So I'm going to put my hands on your shoulders, and I'm just testing for like your joints and everything, any weakness or cracking. Do you get any pain in your joints anywhere?
No.
All right, so I'm just going to have you kind of swim forward twice and then swim backwards twice. Go ahead. Good, in the back. Perfect. So I felt minimal grinding in your left shoulder. Does that cause you any pain or anything?
No.
Have you noticed that?
No.
Not really. All right. Can you like do a lifting weights motion?
Yeah.
All right. So go ahead and do a lifting weights motion. I'm just gonna go ahead and put. You're okay. I'm gonna go ahead and put my hand under your elbows. Go ahead. Good. So your elbows, I don't feel any cracking or anything, and just move your wrists around in some circles. All right. How does that actually? You're like a little bit of crackling, maybe that left wrist.
It always has. I don't know.
That's okay. I would just watch that for like arthritis as you get older. Do you know if anybody else in your family has had arthritis?
Oh yeah, my grandma on my dad's side, she had the rheumatoid arthritis.
Okay.
My grandma on my mom's side, she just says she got older. She could tell she had arthritis, but yeah,
Okay.
I'm sure it's coming.
No, not a problem. So I'm just gonna go ahead and I can pull these back down. I'm now gonna begin testing some of your cranial nerves as I move upwards. So I'm just gonna put my hands on your shoulders. I want you to shrug your shoulders a couple times for me. Yep. Good. And can you look all the way to the right and then the left? Perfect. Any pain or anything as you do that? So that was me testing cranial nerve 11, which is your accessory nerves. So I don't see any problems with those because you're able to shrug your shoulders strong and look both directions. I'm now gonna go ahead and pull out my pen light here, and I want you to just kind of, well, first of all, I want you to make like an okay sign with your hands, if you can do that. Perfect. And I want you to go back and forth through all of your fingers and then back as fast as you can. Good. And then put your hands flat in your lap, and then flip them up and down, and just do that as fast as you can. Perfect. And lastly, now I'll pull out my pen light. Can you touch your nose?
Yeah.
And when I say touch my pen light, you can touch my pen light. Pen light, nose, pen light, nose, pen light, nose, pen light. All right. So your cerebellar function is all good. I'm now going to go ahead and start at the top of your head and start moving down. And then pardon me 1 minute. I apologize.
It's okay.
I had a tickle. All right. So as I get started with the top of your head, is there anything there that I should know about? Any like mites or infestations or
No.
lice or anything? All right. Any tenderness at all?
No.
All right. Perfect. Perfect. The base. Beautiful. I'm now just going to go ahead and palpate your head and feel for any abnormalities or lumps or anything. Tell me if you feel any tenderness. All right, so I feel a little bit of a mark around this ear all the way down.
That's where the brain surgery for my seizures. It starts here and they curved. You can like pretty much feel it, and it comes around, and then right here by the ear.
Okay. Yep.
I don't know, kind of like a horseshoe around that.
Yep. So I did notice that. Other than that, I did not feel any lumps or bumps or anything that I'm concerned about. From here, I'm gonna go ahead and feel all of your lymph nodes. So I'm just gonna feel your occipital in the back. Just palpating them. I'm gonna feel your pre and post auricular. Good. Your submandibular. Submental. I'm gonna go down your cervical chain. Is it okay if I move it down a little bit? Then can you move your shoulders forward for me? Alright, I'm gonna feel your supraclavicular. Then go ahead and relax. I'm just gonna pinch your clavicle just lightly and test for tissue turgor or skin turgor. Perfect. There was no tenting. If there was tenting, I would be slightly concerned about dehydration. Do you drink a lot of water?
Yeah, I try to.
Dehydrated. Good. And then as I palpated for those lymph nodes, I was not able to feel any, which is good. We don't want to find any or feel any of your lymph nodes. That would mean that you might have some possible infection. So, no concerns about any of that. I'm now going to go ahead and feel for your sinuses. You said you have allergies?
Yeah, they're pretty much done right now. Right. I just still take it because even though the ragweed is done, we go up north for Thanksgiving, and it's like a musty shut-up cabin, so I still get allergies for that. So that's why I ended December 1st. I'm good on allergies.
Okay, so none of that caused you pain or anything?
No,
your
not
maxillary?
pains. No.
All right, so I palpated your frontal and your maxillary sinuses, and I didn't know any like super pressure or anything, as you said. All right, perfect. I'm now going to go ahead and start looking at your eyes. So just looking off the bat, I'm kind of just observing your face. I noted the color and the temperature. Everything looks good. I don't see anything crazy. Nothing's uneven. So I'm going to go ahead and see if your eyes are perla. So perla is just your pupils are equal, round, reactive to light, and then accommodating. So first I'm just going to go ahead and cover one eye. Perfect. Amazing. So this was also testing cranial nerve number 3, which is your oculomotor. You said you wear contacts.
Yeah.
Those never bothered you or anything?
No, sometimes during the fall ragweed, I wear glasses because my eyes are itchy, but it's not a problem.
Can you go ahead and look up for me? Good, and down. Good. Your sclers are wet. I did not know any conjunctivitis, anything like that. No irritation. And your eyes were the beginning stages of perla, so they were round, equal. I'm now going to go ahead and shine this at your nose and just look for reflection. Perfect. You have even reflection. And now just stare at my pen light. And then look to my hand. Pen light. And hand. Good. Your eyes are also accommodating, which is perfect. So your eyes are fully perla. And now I'm going to go ahead and just test your overall 6 fields of vision. This is going to test cranial nerves 3, 4, and 6. 3 is oculomotor. 4 is trochlear. And 6 is abducens. Go ahead and look at my pen light. Just keep your head forward and only track with your eyes. Perfect. So your eyes went in all 6 fields of vision, and so I'm confident that cranial nerves 3, 4, and 6 are all intact. I'm now going to go ahead and move on to cranial nerve number 5. So can you go ahead and clench your jaw for me? Relax. Clench. Perfect. So the beginning stages of cranial nerve number 5, which are your trigeminal, are good. I'm now going to have you close your eyes and tell me where I'm touching on your face and if it's even. This is just going to feel your senses or your sensations.
Both cheeks.
Good. And then were they even on both sides?
Yeah. My forehead, my nose, and my chin.
Perfect. You can go ahead and open your eyes. So cranial nerve number 5, which is your trigeminal, is all intact and good. And now I'm gonna go ahead and jump to 7. Can you raise your eyebrows and like puff your cheeks out and make some funny faces? Good, good. Can you make a smiley face like happy and like sad or angry? Perfect.
Yeah.
Good. So your facial nerves or cranial nerve number 7 is all intact as well. I'm now gonna go ahead and look at your nose. Do you have any trouble with your nose at all? No?
No.
So go ahead and just like look up a little bit. I'm just gonna turn my pen light on and note deviated septums, mucous membranes, and polyps. Good. So it doesn't look like you have anything like that. Looks like your septum is undeviated and is in the center. I didn't see any polyps or blockages, and your mucous membrane looks all healthy and moist. So I don't have any concerns about that. I'm now going to test cranial nerve number 1, your olfactory. So I'm just going to go ahead and have you close your eyes and like have something under your nose to smell. I promise it's not going to be like bad smelling or anything. So you can go ahead and close your eyes.
I don't have a problem with my olfactory.
No?
No.
You can have good smell and everything?
Yes.
Perfect. Go ahead and smell.
Coffee.
Correct. You can go ahead and open your eyes. So it was just some coffee, so you did good on that. I would also test cranial nerve number 2, your ocular, if I had a Snellian eye chart. But you said you go to the doctor and everything with your eyes, so you have seen like the letter chart before, right? Perfect. So that is ocular nerve number 2, or your cranial nerve number 2. I'm now going to look at your nose or your mouth. So just looking at your mouth, it's even and symmetrical. Can you open wide for me? Perfect. Your mucous membranes are perfect and intact and pink and moist. Your soft and hard palate looked good. At this point, I'm just going to have you stick your tongue out and then move it side to side. Perfect. And that is cranial nerve 12. Your hypoglossal. I now have this spoon here. I'm just going to go ahead and have you stick your tongue out, and I'm going to depress your tongue and look for your soft palate and your uvula to move up and forward. And that's going to be testing cranial nerves 9 and 10, which are your glossopharyngeal and your vagus nerve. And then go ahead and say ah.
Ah.
Perfect. All right. So cranial nerves 9 and 10 are also intact, so I have no concerns about that. Do you have any concerns about your mouth or anything?
No.
No pains?
No.
Do you have your tonsils? It looked like I saw
Yes.
your tonsils back there. Perfect. Then I'm going to go ahead and move on to your ears.
Okay.
I'm just going to move your hair out of the way. If you'd like, you can put your hair up, or I can work around
Oh,
it.
no, I'll put my hair up.
Okay. No, not a problem.
Maybe. I don't know what I did with my scrunchie. Oh, there it is.
I was going to say,
I was like, I just had my scrunchie.
I'm sorry, no. You came in with your hair up, but I can work around it.
It's easier to be up.
All right. So I'm just going to go ahead and palpate your ears. I noticed you have earrings. How long ago did you get those?
I got them when I was 6, so 40 years ago.
All right. No problems or anything. You got
No.
those? All right. I'm just going to go ahead and inspect this ear. Look on the ends, forward and back. Nothing to note. I'm now going to go ahead and pull the pin up and back. Perfect. I do not see any blockages. I'm now just doing the same thing. Looking at this ear, front and back. And no blockages. And no troubles with those, like you said, no hearing aids, any trouble hearing, frequent ear infections, anything like that?
Nope, not even when I was a kid, so.
All right, perfect. I'm now going to have you look up for me. I'm just going to look at your trachea. Perfect. Go ahead and swallow. You can look down a little bit if you need to. Perfect. I didn't see any trouble with that at all. I'm now going to go ahead and listen to, or it's called auscultate, for your carotid arteries. So I'm going to go ahead and put my stethoscope in, turn it to the bell. I'm listening with the bell of my stethoscope. I'm just listening for any bruits, which are abnormalities in the arteries. I hear none. Perfect. I'm now going to palpate them one at a time to feel if they're strong and even. Perfect. Good, your pulses feel strong and even. No concerns with anything that we've talked about thus far, correct?
Nope.
All right, at this point I'm going to go ahead and have you scooch back, and I'm just going to start with the chest exam, or the lungs. Move this on over here. There we go. Alrighty. Alright. Any concerns or anything with your lungs?
No.
No? Alright. You said no asthma, COPD, anything like that?
Nope.
Perfect. Is it okay if I untie your gown?
Yep.
Sorry if my hands are a little bit cold.
You didn't even touch me
Do
yet.
you have a shiver?
Yeah, just at the thought of it, I guess.
Alright, so right now I'm just kind of observing your back. I do see you have a tattoo. How long have you had that?
I got that my second year of college, so it's been a long time.
Alright. Noting temperature and color. Everything looks good. See some of those freckles and moles again that you're telling me about. Still no
Yeah.
concerns?
No.
Alright, your neck is even and in line. Your spine is all the way down. You don't have scoliosis or anything like that?
No.
Alright, so at this point I'm going to go ahead and with my middle and my ring finger on both hands, I'm just going to kind of come around and displace your thyroid and then have you take a couple swallows and I can just feel it.
Okay.
I'm going to feel for your cricoid cartilage and go ahead and swallow. And then put my other hand on, go ahead and swallow. Beautiful. Alright, no pain or anything with that?
No.
Alright, good. Then I'm confident to go ahead and begin your chest assessment, or your lungs. So I'm first going to place my hands at the base of your back. Go ahead and take a deep breath for me. Good. So your diaphragm, move my hands in and out as needed. Your AP diameter is 2 to 1, so I'm confident to go ahead and continue on with my lung assessment. I'm going to go ahead and test for it in 12 different areas. So every time I place my stethoscope down, I would like you to take a deep breath in. This can be a little bit tiring for people sometimes, so if you at all need a break, just let me know if you get lightheaded or anything, and then we'll take a break and we'll continue on.
Okay.
I'll start. So I'm using the diaphragm. Go ahead and take a deep breath in. 2. Good. Now just have you bring your shoulders back a little bit so you can see the scapulas. Good. Go ahead. Still feeling good?
Yep.
Good. 8. Is it alright if I move your bra down a little bit?
Yes.
Good. So I'm right here. Go ahead. Go ahead. And I'll go at the base for 11 and 12. Go ahead. Go ahead. Beautiful. Any pain, lightheadedness?
Nope.
Dizziness, anything like that?
Nope.
Awesome. I'm now going to go ahead and percuss in those same 12 spots. So those percussing is just me tapping or knocking on my fingers just like that. And I'm going to go ahead and listen for any resonance. I'm now just going to go into your bra again a little bit. Perfect. And once again. Perfect. So I was able to note your resonance. I did not hear anything that would make me feel like you had any lumps or fluid or anything in your lungs. So I'm just going to go ahead and close this up slightly, and you can go ahead and lay down. Alright, perfect. So now at this point I'm going to go ahead and hand you this, if that's okay. So the camera's at the bottom.
Oops, sorry.
There you go.
Just kidding.
Yep, so I'm going to go ahead and move your pillows. Don't worry, I'll return them very shortly. All right, so I'm just going to go ahead and have you turn your head all the way to the left for me. And I'm just, here, I can hold this for now. I'm just looking for any jugular vein distension. This would tell me that you had fluid buildup in your body. All right, I don't know any. Go ahead and turn the other way. No JVD noted. You can go ahead and take this back at the top. Thank you. And you can go ahead and lift your head back up. Perfect. There you go. If you need to scooch down, you can. All right.
Okay.
If I did know any JVD or jugular vein distension, I would lift the bed up 45 degrees and then go ahead and check again. But I did not see any, so I believe it to be all healthy. All right, I'm now going to go ahead, and is it okay if I lower your gown?
Mm-hmm. Can I take my arms out?
Yeah, of course.
Okay.
All right. So now this is where we'll be doing the chest exam. Perfect. Are you all right with that?
Yep.
All right. So how this is going to work is I'm going to have my stethoscope, and I'm going to be listening to 5 different points on your chest, 1 on your right side, 4 on your left side. And I'm just going to kind of be feeling for your ribs and then the spaces in between your ribs. And I will be first listening with the diaphragm, the large part of my stethoscope, for the lub-dubs of your heart, and then the bell for any of the murmurs. When I get to that last spot, the mitral valve, I will be listening for a full minute because that is where your apical pulse is. All right, so I will begin on the right side with the clavicle, interclavicular space, first rib, first intercostal space, second rib, second intercostal space. And this is the aortic valve. So I'm on the diaphragm. Perfect. I'm going to leave my finger there, flip it to my bell. Perfect. No murmurs detected. Back to my diaphragm. And now I'm going to go ahead and start find the clavicle, interclavicular space, rib 1, first intercostal space, rib 2, second intercostal space. So this is the pulmonic valve. Perfect. Find the space, turn to the bell. No abnormalities, no murmurs. Now I'm going to find the third rib, third intercostal space. This is Erb's point. It should be the loudest part. Yep, your lub-dubs are the loudest. Find the point, turn to bell. Beautiful. And now I'm going to find the tricuspid valve. So is it okay if I go a little lower?
Yep.
Third intercostal. All right, so the fourth rib, fourth intercostal. Perfect. And listen with my bell. Beauty. Now I'm just going to meet kind of where my finger is underneath your bra. Is that okay?
Yep.
So here, fifth rib, fifth intercostal space, and I'm going to go mid-clavicular. So my finger's on it. I'm going to take my diaphragm, place it, and I'm going to listen to this for a full minute. Perfect. So you had 59 beats. I'm going to leave my finger on it, flip it over to the bell, and listen in the same area. And I hear no murmurs. Very good. Any complaints or questions about the chest part or the cardiac part of that assessment?
Nope.
Beautiful. I'm going to go ahead and switch this, and we can help you put your gown back up on this part. Good.
Maybe.
You're all right.
Okay.
All right, and I'm going to hand this back to you, and then we'll begin the abdominal assessment.
Okay.
So is it okay if I lift your gown up a little bit?
Yep.
Here, I'll put your blanket up a little bit higher. All right, are you comfortable with that?
Yep, that's fine.
All right, perfect. I'm just going to go ahead and fold these down too, if that's okay.
Yeah, I forgot.
All right. Beautiful. So right now I'm just kind of inspecting the abdomen. I'm looking from the side. I see your aorta pulsating. That's perfect. I'm going to go to the other end. Good. I don't see any abnormalities, any lumps, abnormal pulsatings, nothing like that. Your color looks good. I'm just going to lightly feel with the back of my hand for the temperature. Your temp feels good. See some of those little freckles again, anything like that. I see a little red mole here too.
Yeah.
Anything concerning about that?
No.
All right, beautiful. So now that I've inspected your abdomen, I'm going to go ahead and auscultate, which is listen. I'm going to use the diaphragm of my stethoscope. I'm going to begin in the lower right quadrant, then upper right, upper left, lower left. Tell me if you feel any pain or uncomfortable.
Okay.
Perfect. Okay. All right, so I heard bowel sounds in all 4 quadrants. And now since I have my stethoscope out still, I'm going to go ahead and flip to the bell. And I'm going to listen to your abdominal arteries.
Okay.
So I have the bell. I'm going to go ahead and find your xiphoid process. Perfect. And your belly button and meet in the middle. And I'm listening to your aorta for any murmurs or bruits. I hear none. I'm going to move down to your renal. And go to your other renal. And then down to your iliac. Perfect. And other iliac. Amazing. I did not hear any abnormalities with any of your abdominal arteries. So back to the abdomen. Now that I've inspected and I've auscultated, I'm going to go ahead and percuss your abdomen. So that is, once again, tapping on my fingers like I did on your back. Good. I'm listening for tympani. Beautiful. I heard it in all quadrants. I did not hear any dullness or anything of the sort. I'm now going to percuss up to your liver border. There we go. So intestines and liver border. So I was able to find it right here, which makes sense because your ribs fall right here. And we know in this position, your liver protrudes just slightly out from under your ribs. So now that I've went and percussed everything, I'm going to go ahead and palpate. So that is just some light pressure on your abdomen. So I'm going to start with light palpation. Tell me if you'll feel anything uncomfortable or painful. All right, so good.
Yep.
So far, so good. Good. And then are you okay with me going with some deeper palpations?
Yep.
Perfect. No pain?
No.
Good. All right, beautiful. So I did not detect anything abnormal with your abdomen. So I'm just gonna bring this down slightly, and I'm just gonna uncover your pelvis a little bit, and I'm gonna go ahead and feel for your femoral pulse. So this can be a little bit like, I don't want to say intimate, but like I do have to go under your clothes to find your femoral. It kind of sits alongside your groin. Is that okay?
Yep.
Would you be able to go ahead and frog out your legs for me a little bit? That's just bring them out to the side. Perfect. All right. So I'm going to go ahead and just feel for your left femoral. Perfect. So my fingers are right here. Good pulse. And now I'm going to go over here. Perfect. My fingers are right here.
Mm-hmm.
All right, and now I'm going to go ahead and auscultate those, so I'm just going to listen to them. And I'm going to be listening with my bell. So I found it, and I'm placing my stethoscope on it. My stethoscope is right here. No abnormalities. I'm now going to go ahead and do the same thing with the right side. Perfect. I found it right here. I'm now going to bring the stethoscope down right here where I felt it. No bruise. Lastly, I'm just going to have you keep your legs frogged out, and I'm going to go ahead and feel that they are even and strong, or strong and symmetric. So I'm right here with this hand, and I'm right here with this hand, so they are strong and symmetric. Good, so I can kind of cover this back up and pull this back down. I'm now going to go ahead and take this and line it up so I can assess your legs. All right, is it okay if I uncover your legs?
Yep.
There you go. All right, just trying to adjust this slightly. Perfect. All right. Do you have any problems with your legs besides you said you pulled your hamstring?
My hamstring, my left hamstring.
Okay. And is that painful right now as you're laying here?
No, not when I'm just laying here. It's just if I try to do certain exercises, I can't yet.
Okay, no problem. I'm just going to go ahead and kind of feel for strength and symmetry. So I see some more of the moles. So first I'm feeling your temperature.
Yeah.
Still no concern about those.
No.
You have good temperature throughout your legs. I feel good, strong, symmetrical muscle tone. Can you go ahead and prop your legs up for me a little bit? I'm just looking at the backs of your legs. I do see some bruising over on this leg.
I've always bruised easily since I was a kid. Those are just from work because I was pushing up against a fence.
All right. So nothing like super concerning about that? Are you on any blood thinners or anything that would do that?
No. It's
Alright.
just, I've always been easily bruised.
Okay, is it alright if I take your socks off and
Oh,
look at your feet?
Yeah.
Perfect. So same thing, I'm feeling temperature. So your feet are kind of cold.
They're
Are they
always
usually
cold. I mean, they don't feel cold to me. I just know that they're cold because they always feel cold.
Okay, so no concern about that.
No.
You can go ahead and bring your knees up for me, and I'm going to feel your pulses. So first it's going to be your popliteal pulses. They are strong and symmetrical. I'm going to go ahead and come down to your posterior tibialis. Good. And your dorsal pedis. Good. All your lower limb pulses are strong and symmetrical. So now I'm just going to go ahead and have you bring them flat again. And I'm going to go ahead and do a sensation test on your legs. So I'm using just a toothpick or a flosser. And so not sharp. I'm going to go ahead and just go ahead and poke in 8 areas on your leg. and I want you to tell me if it's sharp or dull and the location. So for starters, it's going to be left upper leg, right upper leg, left lower leg, right lower leg, left top of the foot, right top of the foot, left bottom of the foot, right bottom of the foot. And this is what it's going to feel like. So here's going to be dull.
Yep.
And here's sharp.
Okay.
Good? All right, so go ahead and close your eyes.
Sharp left top thigh.
Okay, there we go.
Dull right top thigh. Sharp left shin. Sharp right shin. Dull right top of the foot. Dull left top of the foot. Dull left bottom foot. Dull right bottom foot.
Perfect. So you can go ahead and open up your eyes. You got 8 out of 8 correct. So I'm not worried at all about any lower neuropathy or anything. If I were to like have a lower score on that, I'd be concerned with some numbness or tingling in your lower extremities, but I'm not noting any of that. So now I'm just going to go ahead and look at your feet. So I'm just observing. We already talked about them being cold. Looking between the toes. No problem. I'm looking at the bottoms of the feet. I'm going to look at the heels, if that's all right. Perfect. I don't see any wounds, any lesions, anything like that. So your ankle did crack. Is that something that happens normally?
All of me cracks when it wants to. I actually think it was higher up, like around my knee. I don't know.
Okay, so no pain or anything when that happens?
No. Just
Okay.
something always cracks.
No problem. I'm now going to go ahead and test your capillary refill like I did on your fingers. But your toes are painted, so I'm just going to do it on the top of your toe. Good. So the color's coming back under a second, but anything under 3 seconds is good for your capillary refill. Perfect. So that's telling me that you're getting blood perfusion all the way down to your toes. So at that point, looking at them, I noted your symmetry and your strength. I'm now just going to have you, is it okay if I put your socks back on?
Yeah, I can help.
All right. So I was going to say, then I'm going to have you slide to the end of the bed, and we're going to do some more range of motion and strength things. All right. Is that all right with you?
Yeah.
I'm just going to go ahead and move this once again, and then I'll tie up your gown. I might have you hold this right here if you could.
Okay. To my legs.
Right there. Thank you very much. So I'm just going to tie up your gown real quick. Do you have any concerns or anything with what we've talked about thus far in your head to toe?
No.
Perfect. So just for a little bit of a repeat, we've gone through cranial nerves, your lung assessment.
Oh, sorry.
You're okay. I just found your other string. Lung assessment, cardiac assessment. We've done the history. And we're going to go ahead and finish your lower limbs. Perfect. All right. So now I'm just going to kind of come down and meet you at your legs. And then same thing with the arms. Remember how we did like the in and out,
Yep.
up and down. So I'm just going to go ahead and bring your legs outward. I want you to resist.
Okay.
Good. And then resist. Perfect. And then push your legs forward a little bit. Good. And then push them back. Perfect. And then just like gas pedal on a car, can you go ahead and push down? Perfect. And then push up. Beautiful. And then can you just roll your ankles for me? Good. I felt like heard very minimal grinding in your left ankle. Is that normal?
It's normal. I grind everywhere. I'm like almost half a century old.
No, not a problem. You're doing great so far. Everything you're passing with flying colors. So your strength in your limbs are 5 out of 5. I'm now going to go ahead and test your reflexes.
Okay.
So just go ahead and close your eyes for me. And just relax. There we go. We'll do it one more time. Perfect. And we'll find it on here. Beautiful.
That's a good one.
All right. So now that we're sitting up, is there any pain or dizziness or anything anywhere?
No.
You're all right.
You've got a wacky angle right now.
Nope, you're okay. I'm just going to put it back up here, actually. All right. So, no dizziness, nothing like that. All right, then I'm going to have you slowly stand up after I get your shoes on, and then we're going to do the Romberg, and we're going to walk you, okay?
Okay. I can put it on if you...
Go ahead, you can step into it. Perfect.
Yep.
Awesome. And now we have our shoes on. We're going to go ahead and stand up and do the Romberg. So, still feeling good? No dizziness or anything?
No.
Go ahead and stand up slowly. Perfect. I can adjust your gown a little bit. Are you feeling comfortable?
That's fine.
Any dizziness? Anything like that?
Nope.
You're good right there.
Okay.
All right, and I'll come on this side of you. All right, now we're just going to stand with your feet shoulder width apart.
Okay.
And you have hang your hands or your arms down by your sides.
Mhm.
We're going to stand here and you're going to close your eyes for about 10 seconds. I'm just going to note any swaying. Beautiful. You can go ahead and open your eyes. And now we're just going to have you turn and face the door.
Okay.
You had no swaying, so you had a negative Romberg. Now you're just going to walk normally to the door. And I'm going to walk right alongside of you. Good. Stop. Turn around. And now we're going to walk heel to toe. Perfect. And you can go ahead and stop and sit back down.
Okay.
Beautiful. Any dizziness, anything like that as
No.
you were walking?
No.
Good. So, with your negative Romberg, and then your good food, and your nutrition, your exercise, and your movement, if I had to score you on the Braden scale, it would be 23 out of 23. I would have no concerns. And if you have no questions for me, then thank you so much for being my patient.
Thank you.
And thank you, Dr. Huffman.